Thanks for joining us for this edition of the SRS podcast and now videocast. So I'm John Vorhies. I'm from Stanford, and I'm joined by Dr. Serena Hu, who is our new president this year, also from Stanford. And do you want to say a few words to introduce yourself?
No, just how honored I am to be serving the SRS in this capacity, and how humbled I am as well. And also recognize that the person who should be here should have been Laurie Carroll.
Yeah. Well, I'm lucky enough to have called both you and Laurie Carroll among my mentors. So why don't you tell us a little bit about the process for how you came to be in the presidential line? And,
Sure.
Yeah.
So, I think I very quickly identified that the SRS was going to be really important to society for me.
Mm-hmm.
Most of my practice is scoliosis in one way, shape, or form, and therefore learning about scoliosis and being around other people who treated scoliosis was very important to me. My mentor, David Bradford, one of my many mentors, David Bradford, one of the first early ones, was a leading member, and then in my residency as well, David Levine was one of the founding members, and they kind of pointed me in the direction towards the SRS. And I basically found, the more I attended the meetings, the more engaged I got, and the more interested I was in being more involved. And so it started with committee membership, and then eventually committee chairs, and then I became at one point the treasurer. At that point, I think people had started asking me, "Would you be interested?" But looking at the people who preceded me, it was a pretty far reach. But Laurie is actually about the same age as me,
Mm-hmm.
and so we were very excited when she got named and elected. But unfortunately, when she got ill, she had to resign, and they were looking for somebody else, and I was selected at that point, presumably because I had served the SRS in ways that were, helpful and useful. So,
Great. Well, you're certainly very deserving of the post.
well, thank you.
So maybe we can back up a little bit, and you can just tell us a little bit about your childhood and how you grew up.
Oh, okay. Wasn't expecting you to ask for that.
All softball.
It's a little you did say it was going to be softballs. Yeah. Well, I actually grew up in a fairly traditional Chinese family. My parents both immigrated, and I was born, and I was basically expected to be a doctor. Okay, so that's what young Chinese people, about the book about tiger moms and things like
I'm
that.
familiar
or whatever.
with the concept.
I was a very good tiger child. I did exactly what I was told, which was to be a doctor.
Mm-hmm.
And when I got to medical school, I actually I thought I was going to be a pediatrician, which then when I realized I didn't want to be a pediatrician, led me to say I want to be a surgeon and so pediatric orthopedics was kind of the route that I thought I was going to take.
Mm-hmm.
But then through, sort of who the mentors you meet as a resident, it ended up being spine and scoliosis, because that's the part of pediatric orthopedics I like the most. And, that's kind of how I ended up doing scoliosis surgery.
So you mentioned a couple of your mentors earlier, but can you highlight some of the key mentors that led you to where you are?
Oh boy, this is don't leave out people.
Oh, yeah.
There's too many people. Well, so my first spine mentor or scoliosis mentor was probably David Levine, because he was in my residency. And I actually told somebody earlier this week that my first SRS meeting was when I was a resident, and I asked him for a letter of recommendation, and he said, "You're interested in spine?" And he was like the only one in the residency that didn't realize that. But he invited me to the SRS. That was back in the day. You had to be invited to attend.
Mm-hmm.
Okay, and so I came to Vancouver, and my first SRS, and I remember I happened to meet David Bradford there. Okay, and as a young resident, and you meet like one of the gods of orthopedics, you walk in there. I think if you're a famous person or whatever, I almost like fainted at his feet, kind of thing.
Starstruck.
Right, but all he wanted was to borrow my contact lens solution. so that kind of brought it down to the human stage. And then a few years later, I was I guess that year I was applying for his fellowship, which I didn't get. So I sometimes remind people of that sometimes you have to keep trying. And I ended up at Rancho Los Amigos, which was a great place, and had some mentors there, none of whom did a lot of scoliosis surgery. But I did meet Ram Mudiam there. He was an attending there for a while, and he was a mentor. And then I crossed paths because Ohana Babawachi was actually a senior resident with me at HSS, and obviously he's gone on to great leadership and groundbreaking work. And he came to be my attending at Rancho at that time. So we crossed paths again. So he and I have crossed a few times in there. And then I'm trying to think of other people. A lot of my mentors have not always been spine surgeons. Ed Hanley was another mentor, but there's also people that have just, like this society has been people that have just been so helpful. You know, you can come and ask anybody about advice about things, for example. And I think a lot of my mentors are even my peers. You know, David Pauly and you know, Larry Lenke, they're obviously ahead of me in the scheme of things or whatever, because they've done so much more. But it's always been very easy to talk to them and ask them about advice about cases, you know, writing papers, you know, those kind of things, or whatever. So I've been very fortunate that people have been very open to collaboration, asking questions, and just networking.
Yeah, well, and you're now getting the chance to pay it forward, because you're certainly a great mentor to me and a number of other surgeons in this group.
It's very easy to, quote unquote, be a mentor to you, because you're so hardworking and talented. I loved your questions during this meeting here.
Thank you. So maybe, do you have any like general words of advice to somebody who's climbing up the ladder in SRS and how to sort of take on more roles in society, and also maybe advice about how to be a mentor to the people who are a few years behind you?
Sure. Well, I think having a role in the society is really just a matter of volunteering, and just keep volunteering. You know, and when they see that you're interested and committed, you might have to start saying no at some point. But basically, we need people who are interested in working hard and who can deliver. You know, you obviously want to volunteer, and then for something you can do and do well, and then. And when they see, or we see that you can do things well and are committed, you know, get asked to chair committees or do more important committees and things like that or whatever. So I think that's just sort of basics of, you know, learning how to succeed in any environment, you know, like the SRS. And with respect to paying it forward, I think the thing that I find most useful is thinking in terms of what did I want? You know, what did I find useful? Which were the mentors who were best for me, and how did they react? For example, and what did I get from them? Sometimes it might have been what I didn't get from them, but most of the times it was how people helped me. And so paying it forward is exactly that, is taking some of the things that people did for you and offering it to people ahead of you. I think one thing that we do now better than, and that we think about more now than we used to, is not just mentorship, but sponsorship. And I had a lot of that, you know, coming through, as people would not only give me advice or to ask me about cases, but try to kind of promote me in the society and suggest me for parts and, you know, kind of roles and things like that. And that really helps a lot, obviously, is kind of getting your name considered, you know, in different capacities where, you know, they might not know you yet or something like that. So
I'm sure. Great. So maybe we'll shift gears one more time, and if you can just tell us a little bit about your plans for this year as president.
Sure. So one of the great things about the kind of roll-up is that when you get on the presidential line, you spend a couple of years there, and so you get to know what's going on with the society much more intimately than you might if you hadn't spent that time, because you go through all the committee meetings and all the discussions about strategy and where to go and stuff. So I think two of the things that we'll be carrying on, for example, is, you know, Chris Shaffrey mentioned the outcomes and benchmarking app. And so that is going through the wireframe stage where they're just looking at how it wants to look, but they'll be starting the programming, for example, and getting that out to the members, getting them to, you know, want to try it and use it, and promoting it, working through the details about data ownership and that kind of thing. That's obviously something that Chris will stay involved with, but I'll obviously have to continue to push, as with the rest of the PL. One of the things that I think came out of my time as treasurer is because the treasurer is the Finance and Communications Council chair. But communications has changed so much since that council was sort of started or designed or whatever, that we actually broken it out as a separate council. And so Ron Alwari is actually the council chair, but also is working on a task force to kind of decide the strategic efforts for that council. So the way communications isn't just a newsletter anymore, isn't just a website anymore. It's about it's so much of what we do as a society, and so helping promote that and helping guide that and leave an imprint on that, I think, is really going to be important. And the other thing that I think will be something that we'll be working on pretty strongly is leadership development. So as you know, we have an early career surgeon pathway. We have diversity, equity, and inclusion committee now. And I think you bring it all together, and you also build a better foundation for your society by working on leadership development. So the questions you asked about, how do you rise in a society?
Mm-hmm.
That should be, I don't want to say prescribed, but it should be more easy for people to understand what to do,
Not
how to
secret
get there.
Information.
Secret. Some people we want to keep it. I'm just kidding. But giving people the skills and the tools to learn if that's what they want to do, to improve upon it if that's where their skills are, so they can do the best that they can for the society and for their home institutions and for the profession.
Great. Laudable goals. All right. Well, thanks very much for taking time out of your busy and increasingly busier schedule. I think we'll wrap it up then. Thanks for joining us.
Well, thanks very much for the interview, and I very much appreciate having you as part of the team.
Oh, pleasure's entirely mine.
The Scoliosis Research Society is a nonprofit professional organization made up of physicians and allied health personnel. Their primary focus is on providing continuing medical education for healthcare professionals and on funding and supporting research in spinal deformities. Please visit srs.org for further information.